Last question. We hear a lot of leaders talking about cloud first strategy. What does a cloud first strategy mean, and why should a health system be thinking cloud first strategy?
Like everything, cloud isn't a silver bullet. I mean, it's a new way to get services that we may have provided to ourselves in our data centers in the past. We're really risk averse in general in healthcare. So I think ultimately you have to look at what you are willing to let move to the cloud and find a way of working through that strategy at a pace that's right for you. Personally, I think you should hurry up. I think, we're kind of definitely in the going too slow mode right now, but whether it's a software as a service provider or putting your backups into the cloud or giving your research guys and ladies access to cloud services to support scaling up and scaling down research projects without buying the infrastructure, for your own data center, for your own property. All of those are good, maybe not business critical or clinical critical operations. If you kind of want to get started and figure out how to move, but I think it's mostly about moving. And then the other part is, and I go back to security and all of this, this is a new complicated architecture, right? You don't have this all in your data center now. So make sure that as you're thinking through this, think about what's your architecture going to look like and how are you going to connect these pieces together and protect them, and what's your incident response plan when something goes down. All of that is still important even as you move to the cloud.
Yeah, absolutely. I mean, I would disagree with you a little bit on that one.
Okay.
And we're just different in terms of our risk posture. In 2011, I brought Box, Dropbox equivalent Box into the health system. And it enabled things that were not possible prior to that. There was nothing Microsoft offered in 2011 that even remotely got close to the amount of collaboration that happened in a secure, auditable environment. That's one aspect. When we moved to cloud infrastructure, we went from 2 to 3 weeks to provision a server to 2 minutes. When we went to DevOps, we went from 35 people running our DevOps or running our infrastructure to 5. I mean, there's a ton of cost savings and things, a bunch of agility that you can get to, a bunch of things that's why I built this. I built the company that I started around this cloud infrastructures, because I think the number one thing holding back healthcare is this thing called architecture. And I think we've allowed ourselves to, just a decade of this change without an architect looking at all of them. And so we've ended up with this mess. And instead of saying, we're going to purpose build this environment to be agile, nimble, cost effective, and efficient. And because we've done that, and we still think that that's the norm, we are way behind other industries, and we don't understand why we can't move faster. And I think the cloud is the first step.